afternoon and welcome to United TV. This is Kemal Erkan. Today is January 17, 2025. Today is going to be a very special session for us. We are hosting Dr. David Feinberg, Chairman of Oracle Health. We are going to explore how technology is shaping the future of healthcare. He and we met just recently in Oracle Health health conference, and we were able to talk about a lot of different issues. I attended a lot of sessions, and I was part of the 2 panels with Oracle. So knowing technology is extremely important. We wanted to share Oracle Health's vision and what Oracle is trying to do in the healthcare. Now, with your permission, I'm calling you David. So well, first, welcome to the show. We really appreciate for you taking your time, and I know you are busy, and I'm going to have some questions. But before that, I want to actually just give very quick background on our relationship with Oracle Health. So me personally, actually, I go all the way back to 2000, May 2000. So I started with that time with Cerner. So the time, 25 or 24 years. It may not be a lot of years, but in technology, it's more than a century. So just so that one thing that I remember, in order for us to get the internet connection for the system that we were using that time, PowerChart, so we had to have T1 lines for each location, and the cost of that T1 line was $2,200. So because the internet was not there and wasn't available as it is today. So that's where I was coming from with Cerner and Oracle Health right now. So, and in 2015, United Medical officially become part of Oracle, that time Cerner. And since then, with the system that Oracle Health provided for us, we are one of the unique organizations in the United States, or United Medical right now, with the accountable care organizations, with 8 different programs that we have, with almost 90,000 patients under the value-based care. The only reason we are able to do it is because we have the support and structure of Oracle Health today. And on top of that, we also are working very closely with Oracle Health in some cases, as a design partner, as a beta partner. And for me personally, and for my company, it's an incredible journey since May 2000. So now this is going to be not about us, but it's going to be about you and Oracle Health. So I want to start my first question with kind of just setting the floor for those who are listening to us, why healthcare is important. And from that point, understanding hospital-centric care versus patient-centric care. And knowing that hospital-centric, just for those who may not be so close to these, understanding the delivery system within the hospital, emphasizing the infrastructure or specialized care and the acute treatment. But we want the patient-centric care, and this is all about personalized, accessible preventive care. So with that, I think this question makes a lot of sense. Someone like you, because your prior responsibilities, Geisinger, UCLS, and Google, you probably in the best position to answer this. We want to understand how Oracle Health is leveraging technology to shift the focus from hospital to patient-centric care.
Perfect. Well, first of all, I'm so excited to spend time with you, Kemal, and thank you for being such a long and loyal customer. And as you were talking about what's happened over the last 25 years, my mind went to, God willing, if you and I are here in 25 years from now and we had a conversation, what would the next 25 years look like? And when you see this, so much happening with technology, literally in the last couple of years, you just go, wow, what could it be? So let's pencil in that date, whenever that is. I guess that's in 2050 that you and I will get back together. But around your question around patient-centered versus hospital-centered, I would say we want to go even more forward and be community-centered. But my background just really quickly, I'm a child psychiatrist, and I worked 25 years at UCLA. I had the opportunity to run the UCLA health system as chief executive, and then I went to Geisinger, one of the kind of storied, innovative, value-based examples in the United States of healthcare, and that was an amazing experience. And then was able to move to Google and lead Google Health before taking on the job of CEO of Cerner. And now that we've been bought by Oracle, I'm chair of Oracle Health. So I've seen healthcare from a lot of different angles. Obviously, like all of us, I've been a patient, I've been a provider, I've led fee for service, fee for value, and now kind of round two of leading tech in healthcare. So here's my answer. And I sometimes get in trouble with this answer. So I'm sort of saying it tongue in cheek. But the way we see it is any hospitalization is ultimately a failure of outpatient care.
Mhm.
And any outpatient care is ultimately a failure of home or self-care. And any home or self-care, and this is where I get it, well, all of it gets me in trouble, is really a failure of community care. So if you really go really upstream, and all of us lived in places that had access to good food and were safe, and transportation wasn't a problem, and there was a robust economy, and we had good jobs, in a sense, loved our community, then you would see about a 50% reduction in the need for any healthcare. Literally, it disappears. So, right, if we got that right, we wouldn't even have to take care of ourselves at home, because when we could go back to our opening thing of the next 25 years, there may not be motor vehicle accidents in 25 years because of technology advances. So that's
Right.
community care, preventing what are often tragic and certainly high mortality incidents may disappear. And that, to me, is that loving the community. And then the next step is, if something goes wrong, most people actually care for themselves at home. But the hard part about caring for yourself at home or in the clinic or in the hospital is it's hard to get the right information. And we could even talk about present day, should I get a COVID vaccine now?
Mhm.
Um, what about bird flu? What should I do if I'm pre-diabetes? Should I wear a glucose monitor? Which diet should I be on? I mean, there's so many questions that I think everyday folks ask themselves that we don't necessarily have good information for you to do home care. So part of what we're doing is really focusing on getting multiple disparate data sets together, normalizing them, and then getting them in a way that community folks, like someone in charge of population health or how you focus on the community, would have that data, or an individual. And then when you get to outpatient, right, again, I keep saying this is a failure the further you go up into the system. When you get to outpatient care, so many times we repeat tests because we can't find the colonoscopy. So again, how can we get data in a way that allows you not to have to spend 5 hours to understand your next patient, but use AI to use it in a way that actually gives you a great summary of this next person you're going to go see? And the same for that patient, that I don't think people really want their medical records. I think they want knowledge. They want to know, what's their bad cholesterol? When's my gynae appointment? They don't want just PDFs of their labs. They want to be able to interact with them the same way as an outpatient doc would. And then in the inpatient setting, we've made it incredibly impersonable. We created these things called hospice. It's very, very discombobulating to be an inpatient. And so much of it is because people are just looking at the computers and no one's actually talking to you. Oh my gosh, you're a retired school teacher and your husband just passed away and you love cats. Like, there's not that time for that interaction because we're spending so much time doing documentation,
Right.
looking for things. So everything that we're doing around making the electronic health record work much better, around connecting disparate data sets like social determinants of information, is to move people upstream so that we have less illness and burden to deal with. And then if you do get something bad, you can care for it yourself most times. And once in a while, you go to the doctor, and hopefully you never end up in an inpatient facility. Now, as I say this, and I sometimes say I get in trouble, what the other place that technology is pretty amazing is new things have come that, well, when I was at UCLA, we built a new hospital and we made it less beds. We went from about 700 beds to 500 beds. And everyone said, that's even too big because everything's going to move outpatient. And managed care was happening. It was like in the mid 90s. And what the lesson was everyone was right. It did move outpatient, but then new things came in the hospital that we never dreamt of. We were putting new valves in 90-year-old people that we would have never thought of. So those acute care facilities are still needed because there'll be advancements of things we can do to really, at a high-tech level, save lives. But we need to have that capacity there for that to happen by moving the rest of the stuff outpatient, home, or community. I hope that makes sense.
That it does. And actually, when you were explaining this, one of my recent personal experience with my mom, I just thought about that. She lives in Turkey, and as you know, we have an outsourcing office, our internal outsourcing office in Turkey, and I go there every 3 months. And this time there was a wedding of my niece, and I went a little bit earlier, and I went a week earlier than my expected time. So then my sister and my nephew, they worked with me. So then I just wanted my sister to have enough time, and then she doesn't have to worry about, the wedding and the office at the same time. So, but I went there, and then I had this ride with my mom's emergency, and this is happening on a Monday. Friday before, apparently she had a heart attack, but she didn't notice. Now, with females, I guess with the diabetes, they don't have same symptoms that we do. So then they don't have chest pain. So they can actually have a stomach, upset stomach. And she did throw up, and then she felt better. And my dad, luckily, he was home. Normally, he has his own place. So anyhow, so I took her to one of the private hospitals in Turkey, and the focus was on the stomach. So then they give us 3 medications, and then they schedule an EGD. And then next day, things didn't look good. So we have wedding a couple days after this is happening. So and in Turkey, this is what they have. So it's I think it's kind of cool. Now I'm getting used to those things. Being here for 25, 26 years, I'm not as familiar as I was before. So everything is like, I'm like a tourist, like, oh, like you can do that. So they can bring people home, and then they can get IV fluid, like the vitamin support and those types of things. So since I had that before, I'm like, well, Mom, you really don't look good. Maybe you just need some vitamin support. So as that was happening, they came to house in 30 minutes. So as that was happening, my dad was giving me more details from the Friday before, and we are like, she probably needs an EKG, at least to see if there's any heart-related issues. So, and being very stubborn and one of our family features, I guess, so she didn't want to go to the doctor because that means she could just not go to the wedding, perhaps. So she was delaying everything after the wedding. So these guys, the one who came to the house, they were able to do EKG at home. They called someone, and then that person came back in 20 minutes. And we did EKG abnormal. They took blood work. The troponin is 3 times. And that night, we end up going to the hospital, and she had a triple bypass. So what I have seen with that whole process is, so what patient, like patient understanding what this emergency can lead to, is it starts with the patient. So then it goes to the provider. So like the hospital failed in this case. So, and even after she went back home, she's doing very well right now. But just recently, she stopped one of her medications, and she has a nurse full-time with her. And both of them were hiding that from us. And so patient has a lot to do with this. And I'm 100% with you. But I think this knowledge and information that needs to be available, and keep the age ranges in mind. So how they are actually accessing to this, that's kind of like the key. So, and I agree with everything that you said. It's just like the difficulties at the patient level, and how much, like, I can multiply my example with even myself. Like I just wait until the last minute. I'm like, okay, so I'm so much in pain now, I have to go to the doctor, rather than when certain things start. So I think this is more like a behavioral change, as well as technology being available for people. And I now know that we are actually in a much better place with Oracle Health's vision and what we do with our patients, with the accountable care organization. Like just imagine, like 5 years ago or 6 years ago, we didn't have social workers in our office, in the central office. We didn't have dietitians. And we start doing case conferences. This is a daily discipline. So I spend about 2 hours every day, 1 hour for ACO, 1 hour for our bariatric program. And you get a lot of information. And now we understand how much we can support these patients and prevent a lot of hospitalization. But that also only happens with the good technology being available. Now, I'm going
Wait,
to
can I interrupt for a
Of
second?
course,
I got a question on your mom. So she's doing okay. She missed the wedding.
she did miss the wedding. So, but like she she didn't want us to cancel the wedding. There were 400 people. It's just going to be late. We had a lot of high profile names from the government. So just like it wasn't going to look okay. As long as she was doing fine, she just didn't want wedding to be canceled. So I was actually taking care of her in the hospital. So I went to the hotel that the wedding was at. So I changed, and then in my tuxedos, then came back to the hospital in my tuxedo. So that's how it was. But we'll make it up somehow. I don't know how, but we will.
Well, I guess the good news is they got married, and the good news is your mom's okay.
Right.
So congratulations.
Thank
In
you.
my world, we say mazel tov. So
So we may have some commonalities there. So I'll tell you later.
yes.
So now my next question, this is kind of from the first one, just building on that. Now we have competitors. Oracle Health has competitors, and good or bad, Epic is getting some good PR these days. But then that is changing. So in the last 6 months, we know that they have some issues there too. But competition is inevitable. So we are going to have that either with 1 or 5 companies. How is Oracle Health positioning itself for addressing these interoperability and clinical burnout challenges? Do you believe that technology can help for those issues, and at what level?
Great. So from a competition standpoint, at Oracle Health, our competition is heart disease, diabetes, undiagnosed mental illness, problems with access. That's who we're fighting, and we hope Epic does really well against that same war. There's plenty of suffering to go around for all of us to be successful. Specifically, though, when you get into the actual strategies, I would say we have a winning strategy, and now that we've become Oracle, our Achilles heel had always been execution, and that has not only been resolved, it's blown me away. So let me give you a couple examples.
Mhm.
So the first thing we need to do is fix the EHR, because if you talk to frontline docs or nurses, regardless of, I like to point out I'm the only one who's run an EHR company that's ever had to use one. And when you talk to the users, it was never built for them. It was built for billing and coding and meaningful use and all kinds of things. And there's a great story behind the why. That doesn't matter. If I'm a busy PA in an emergency room or a busy outpatient oncologist, I don't care about it. The why, I want to why am I spending 2 hours at home doing my charting? So we just launched, and it's now general availability, our new electronic health record, AI-based. Let me describe it. So first of all, it's the only one that's full stack where you go from cyber secure cloud, military grade on our Oracle stack, all the way to the end user. And it does a bunch of stuff. It's context specific. So if I came into the electronic health record as a psychiatrist and I'm on the inpatient pediatric service and I'm evaluating kids for organ transplant, some bizarre little niche, the
Mhm.
EHR opens up, it knows who I am, it knows what I want to see. And then it does some things that no one else has been able to do all together in an integrated fashion. So let's pretend I'm an outpatient doc and I'm going to go see my next patient. I say, hey, Oracle, tell me about my next patient. And it does, AI generated, a summary on that patient that captures information from the electronic health record, from health information exchanges, other electronic health records, and 2,000 public data sources that help me understand that patient. Things like food insecurity. I happen to be in Los Angeles right now. Am I near the fires? What's the air situation? All of that is captured in 1 or 2 paragraphs, as if you had an amazing medical student who stayed up all night summarizing your next patient. So you now got it in whatever, a millisecond. Okay, now I go in the room and see the patient. And when I'm seeing the patient, they've given me permission to put my phone down to do the ambient listening like other systems have. So it's listening as we're talking and how are you feeling? Is pneumonia better? But you know what? Your diabetes seems a little out of control. I can now do inquiry. So in the middle of the ambient listening, I say, hey, Oracle, tell me about my patient's hemoglobin A1Cs and correlate it with when I change metformin dosing. And that's then brought to me right there. So no more looking for information. It's using your voice to do that inquiry. So we have the summary in the beginning. We have the ambient listening. We have the inquiry. And then the piece de resistance, it does all the actions. So it writes my note. It writes a note to the referral. It sends a note to the patient. The patient wants a note to their sister who happens to be a nurse. It can change the language for that note. It does the billing, the coding, the scheduling. Everything is done, human in the loop in every step. So I've now seen the patient. I got a better summary that I could have done myself unless I had 4 hours. I was able to interact. I never, ever, ever took my eyes off the patient. I never went to the terminal. So from when we've seen this, patients love it. They're like, oh, my doc seems like they're so less stressed. And then when I'm done with my patient, I don't go home at night to finish the record. Okay, that's amazing. And then you add to that things like auto adjudication. Now that the note's done, we can actually make sure as the patient leaves the office, their bill is done. So they don't get these EOBs at home that they don't understand. They can auto adjudicate as they walk out of the clinic. You owe $15, you want to use your HSA or Venmo, like a Uber experience, right? Not only that, through this whole thing, if this patient was research appropriate, those types of clinical trials come up automatically in the electronic health record without me having to swivel over or look, does this patient qualify for an oncology trial? So that's what we say when we say fixing the electronic health record. That's out right now. And I was talking to a doc from Knoxville, Tennessee, who I met a few years ago. When I go around and meet customers, there's always those people who are really, really mad at you. He was one of those, right? So this is the guy, Cerner doesn't do this, and you don't do this, and you don't do that. He's now our spokesperson for this clinical digital assistant. So not only has he become, have we won him over, he said that in his practice, he actually treats quite a few retired physicians. And when he's done seeing them, he says, look what this thing just did. And many of them have said, I wouldn't have retired. So we really think this will solve that burnout piece. And when you say, you know, head to head against Epic or the others, no one else can offer this fully integrated. So that's great. The second thing, which I would describe as almost greater, is we're not an EHR company anymore. We're an end-to-end platform. So this cloud-enabled platform can connect things like back office, human capital management, ERP, which is budgeting, supply chain, to the clinical side. Every other industry connects those things. We have never done it in healthcare. So what are the use cases? Well, let's pretend I'm a nurse and I got trained on chemo 3 years ago, but you know, I've not been on that unit, and now I'm on the chemo unit and I'm about to give chemo for the first time. We should know that from human capital management and have just-in-time refreshing training in the EHR right as that nurse is giving chemo. I'm in the operating room. I use ambient listening and did my whole note. Great. I replaced the hip. That should actually drive supply chain so we have the right supplies there next week for the next cases. I'm a population health manager. You know what? We're down on mammography, or maybe we need a colonoscopy campaign. Hey, Oracle, help me set up a colonoscopy campaign. It shows me what the cost will be, what the staffing will be. Do we have enough, GI rooms to do it? So this whole thing now gets connected in a way that no one else has been able to do it. So we're not worried about the competition. I think platforms win. And when we say platform, that's what we're talking about. And then the other piece in this, and this does differentiate us from some of the other big players in electronic health records, we're going to be wide open. 300% increase in open APIs. We want all the innovators out there, because we do not think we can do this alone, to build on top of what we have, versus others who've said, no, we don't want you to do that. It's on our roadmap. We're going to build it ourselves. We are not a walled garden. We are an open, connected platform beyond just EHR. So that's what we're up to. And I've never been so excited. And the combination of becoming Oracle, which really, really accelerated our product roadmap, the new kind of Gen AI that's allowing all this to happen, our amazing installed customer base that's hung in with us. It's now showtime for us. So we see 2025 as a banner year.
And I think 25 to 30 providers from our ACO are already using this. We were one of the early adopters. It's a game changer. So being able to, it's like, because I'm not a clinician, I can maybe give the example of ChatGPT, what it does for us. Now, I don't know if everyone is paying the level that I'm paying, but at my level, so I can have a dialogue with ChatGPT. So then I don't get any dumb answers. So it's always smarter than me in many cases. So then I'm able to build a really good, like even prepping for this event, I utilize that. So while I'm not a YouTuber, I'm a full-time CEO, and we want to do this because we believe this YouTube is extremely important for us for so many different reasons. But I also don't want to spend 20 hours for this for every week. So if I'm able to do this in 1 to 2 hours at night, then I have a couple individuals in my team helping me to keep things together. So then I'm efficient and I'm able to do it. Otherwise, I wasn't going to be able to do it. So this kind of like the burnout issue has a lot to do with how much work the physician or provider has to do the job. And I think healthcare was way behind with any other technology. And I remember in the Oracle Health conference with Larry Ellison explaining the credit card company's logic of this brings me to my next question. So it's like, why are we able to do this with the credit cards financial system for so many years ago, but then we still don't have the national health record database? And I know this is one of our, from the Oracle Health side, this is one of the big goal to create have the creation of the national health records. So I know there are some challenges with this, but I know yourself and your team, Larry Ellison, you guys are all committed to this. So do you see any timeline for that? When do you think that we would be able to accomplish that?
So I think we've done some huge steps actually outside the US. So our kind of One London, we're exchanging, I think, 14 million records a day. In the NHS, the primary care part is the last piece to kind of pull in, but from the kind of what we would talk using US words, the hospital and the ambulatory centers are connected. So it's not hard from a tech standpoint. It's doable. I think your credit card common is a great one. 80% of the world's credit cards run on Oracle. And when I became part of Oracle and they kept talking about financial services, and I said, well, but financial services aren't structured and unstructured data in the same way healthcare is, right? There's a lot of that unstructured stuff. And they said, oh, no, it is. I didn't understand. And then they explained it. And it makes sense. When you're doing fraud detection, and some guy's naming his yacht, some code name, and using money over here in emails, like that is unstructured data, plus a bunch of, what we would call lab data in rows, which is my, what's in my savings account and my checking account. So really big experience with structured and unstructured data and understanding it. Great. That's perfect for healthcare. In the US, what we're doing, we think the right strategy is to build all of these things in an EHR agnostic way. So we don't care if you're Epic or what we would historically call Cerner or Oracle Health, Athena, Allscripts, Meditech. We don't care what EHR you're on. We're building things on top that will interact with those electronic health records. And I think we've now been through 3 or 4, I guess we're about to start a new presidential administration. But if you go back, it's been Democrat, Republican, all of them, thankfully, interoperability has not become bipartisan. Like every one of those administrations has pushed it. So we're continuing to see pushing it so that that data can be captured. And that's what we've built with our health data intelligence platform, is a way to capture that data, EHR agnostic, and then give it back to folks wherever they need it, whether that could be the frontline doc, or that could be somebody when we're outside the US, the minister of health. Like at any level in between, people need to see it in a different way, but it is the same data. So really thrilled that we have non-Oracle Health EHR customers that are adopting our health data intelligence, which is that platform that sits on top and captures that information. Now, it comes out of the box if you were to get our electronic health record, but I don't want to make this a commercial.
Well, for those who may not be following some of these credit card logic, there's Visa and MasterCard, but then all the banks are using those. So you don't have Visa for each bank separately, right? So then there's one system that everything is kind of in the center. So, and then all the banks are benefiting from it. So then in the case with the EMR, EHR logic, everyone is in their silos and not communicating. And like, one of the things when I was at the panel for access and what we are able to do from the cloud standpoint, from the Oracle Health side, and, I was there with 12 people from my office. So some of whom they've been working with me for 20 some years, some of whom, anywhere from like 8 to 20 years. So none of whom knew anything about my health. So if I had some emergency, like at the dinner we were together, so if I had food poisoning, none of my employees would know anything about it, right? So then they were going to take me to one of the hospitals. If the hospital is not using Oracle Health EMR, then we are in trouble. So we have to duplicate so many different things, so much money needs to be spent, so much time needs to be wasted. So this is all about like having that access and having it in a meaningful way, in a timely. So I believe, I think the vision that I see from Oracle Health side is going to take us to the future. And I believe that's going to be extremely beneficial, not just for us, but for all those who are not have the same vision. So now I want to shift gears a little bit. And then, this is one of those things that, I go through this with my business time to time. When changes happens, there are people who are happy and then there are people who are not happy. And when we went from Cerner to Oracle, personally, from my point, I believe this brings a lot of opportunities, and I was happy with what was happening. Not because we were not happy with Cerner. It's just like Cerner was an EMR company, EHR company that kind of maxed out and wasn't able to maybe support what's needed, what was readily available. But yet, some people, they kind of have these emotional attachments. So I wanted to kind of understand from your side, how did you guys handle that transition? And you were actually the acting CEO at that time with Cerner. Just for those who may be business students, maybe watching, just kind of help us to see how you went through that process with from Cerner to Oracle Health.
Yeah, I'm happy to talk about it personally and then how I think the organization did. So I came to Cerner. It's a Fortune 500 publicly traded company. It's my first job as a CEO of a publicly traded company. 8 days after I get there, I get a letter from Oracle basically saying they want to buy us. It took about 6 months to negotiate the deal. I had to do my investor calls. Like, we only had 3 or 4 people plus the board that knew this was going on. And then we announced this storied company that grew up in Kansas City is now being bought by this tech company that, really came from Silicon Valley, but had just recently moved headquarters to Austin. And what does that mean? And all this stuff. And, did I know before I came? And how could I do this? And all kinds of um, questions. I didn't know. I don't think I would have gone had I known. Now, knowing what I know, I would have jumped at it. But anyway, so when that's in negotiating, right? So negotiating with Oracle, um, and what does it mean? And man, you get a lot of advisors and they give you different advice. And it was, I describe it as the hardest 6 months I've ever worked. And look, I did a pediatric internship where you were up a night. I was up more nights during this 6 months with phone calls and dealing with it. And there were a couple things that stuck out. One, Larry said, this is a reverse merger. I didn't know what that term meant.
Mm.
I get it now. What he meant was Oracle's not taking over Cerner. Oracle is going to, through Cerner, infuse technology, but your understanding of the industry and your healthcare relationship, Cerner in general, is going to be what leads this, as opposed to, hey, we know better than you guys. That humility, I think, was key. And the other was, we're not going to just fix the EHR, we're going to build this platform that we just talked about. So those two things stuck out. Then the thing happens and like it gets approved in everywhere but Austria, and we got to wait and all kinds of crazy stuff. And you got to make sure people get the right emails and they get their paychecks. Like, it's hard to absorb I don't know, we were 45,000 people or something. Oracle, 2/3 of people at Oracle, 160,000 employees, are there via acquisition. So they're really actually pretty good at this. And I've never been through this before, so I can't compare it to others. I thought it went great. I mean, it could have gone faster. There were mistakes and all that stuff. But now, if we catch our breath, we've maintained the core, what was Cerner business, and the future is incredible. The roadmap and the potential, to me, is mind-blowing. Like, we've become now a real grown-up company instead of a mom and pop startup, like the other EHRs, if you really think about it, right? This is a major software company, worldwide, global, that doesn't just do healthcare. So it's been great. And then there were about, I don't know, 4 or 5 decisions early on. There's like a year period where before you officially have the change of control, but they've written the check, you can't make any decisions without checking with Oracle, right? In these transitions.
The transition.
Yeah. And so it's about a year where, like, you can't even hire a senior person. You can't cancel a program. Like, you can't almost run your business because you got to check in with, Big Brother. And there were about 4 or 5 decisions that were made by Oracle during that check-in process that I thought were wrong. And I said to my wife, they give you an incentive to stay for a year, and I'm going to stay for a year, and then I'm going to leave because it's pretty clear this is just tech thinking again they can do healthcare, and they don't appreciate healthcare the way I understand it. Every one of those decisions, they reversed. And that's pretty amazing. And when the year ended, I was like, I'm having a blast. I want to stay. And they're like, we want you to stay. So I went through this. That was clear. So now I'm 2.5 years into Oracle. I went through this process of, I moved to Kansas City. The company got sold. I'm going to have to get a job in a year, to today, where I would tell you, I have never been more excited and more focused and more passionate and more humble about the opportunities ahead of us. And so your answer to is, how to go, I mean, in some ways, this was a miracle. Like, this is amazing that we've been able to pull these together. Biggest EHR company in the world. We are the biggest EHR company in the world, which I like to say to the team, that means we have more grandma's blood sugar than anyone else. And now let's do right by it. And I think we really can.
Now, I'll tell you, like even with very small transitions, one of the issues that I always see is I took over some medical offices, and there's always this attachment to the prior owners who are actually now employee physicians of us. But these are physicians who didn't want to deal with the business part of it. And they came to me, they were my client for so many years. They're like, Kemal, I want you to run the business here. Like, they didn't charge us a single dime. So actually, legally, we have to have $1 on the agreement. So, and their whole issue was, we just want to practice medicine. But even with that, we had a lot of pushback from employees of those practices. So, and then sometimes we undermine how much trouble that can be. And I learned that in a hard way in the beginning, but now we are more proactive when we are doing it. So we have enough resources available. So, but this transition we are talking about, it's almost like the two countries are merging. So it's huge. So, and I agree with you how, like, if you take the first maybe 8-9 months, because it impacts us in different ways, but then everything changed, and I see where we are right now. So I can see a much clearer future for our organizations. So, and also, like, as you said, like this was a tech company coming into the healthcare, but seeing Larry Ellison's personal interest in healthcare is also really important. So otherwise, this would be just any other business. But having someone yourself who's a clinician, but also have the business background, understanding healthcare, I think this is how we can make this happen. And I'm very happy where we are. But if you ask me, maybe 2.5 years ago, that would be different, but today we are in a different level. And I think that's going to bring a lot of other good changes in a good way for us and for Oracle Health. Now,
Yeah, the Larry Ellison thing is fascinating because if you go back about when this whole thing started and he talked about healthcare, he was pretty knowledgeable on healthcare, but I don't think he was I don't think he got it completely. Now you hear Larry Ellison talk about healthcare and he's like, he nails it. Like he gets it, like beyond. Like I'm like, oh my God. So I say to my Oracle people, wow, Larry really is, amazing now in healthcare. And what they say back to me is he can do that in every vertical, hospitality, energy, retail, everything that Oracle has done, he's become expert in. And I'm like, and this guy is doing product reviews with us like every week. I'm like, he's amazing. And so to have the founder leader focused on this, and his intellect has just blown me away. We send slide decks before we go over, and he's memorized them before we have the call. And then he's put his time in. So that personal engagement, shifts the whole company. But I've never seen a guy learn something so fast, and they're like, oh yeah, he does that in everything we do. I'm like, oh my God.
So one of our design projects with this new patient accounting, I didn't talk to him directly, but the team is telling me that he's actually in meetings on the other side, and I'm like, well, he's even into that, so that's really good. Now, I want to talk about the ambulatory care, which what I represent with my organization, and one of our criticism that we used to have for former Cerner. They were heavier on the hospital. This is like several years ago. So then ambulatory care was not there yet. Then in 2010-11, it picked up, and then we made a lot of improvements, and things were better. Program was better. But now cloud coming into the picture, sometimes it scares people in terms of the cost and other challenges. So how do you see cloud actually supporting ambulatory care, outpatient practices like us?
Yeah, so I think cloud is crucial for the whole thing. ambulatory inpatient, both from a cyber standpoint and from we can give you updates every month like you would get on your iPhone instead of, we can keep everybody on the most modern instance of it. The ambulatory, I think we're using words that should not be used anymore. Things like ambulatory, acute, pediatric, oncology, rheumatology. Those are all provider-specific words. Like if I'm a patient, and I have multiple chronic conditions, I'm sometimes connecting with a nurse on telehealth. I'm sometimes in a clinic. I'm sometimes in an infusion center. I'm sometimes in a hospital. I'm sometimes in a post-acute facility. So the EHR that we're building is first of all, it's all the same data, right? It's all data about me that should be accessible in a way that's helpful to the person who's caring for me at that time. So that's what cloud allows us to do, is to create a context-specific view for whoever's in that caring relationship, either the patient side or the provider side. And we launched it as ambulatory EHR, but it's as much ambulatory EHR as it is a portal for a patient, as much as it is a complicated inpatient or pop health. It's the same data. It's just never been flowed. It never had the right flow, and it's never been normalized, and it's never been accessible and able to be analyzed and teed up in the right way. So the ambulatory EHR, and I want us eventually to get rid of that word, is just the tool that your clinicians will use to take care of patients, but it has the flexibility to go with that patient wherever that patient may go. And then I'm probably again get in trouble with this. There are some unique things to ambulatory that we have to get right that don't make sense in other settings, but those are really around the edges and they're configurable. The underlying code is consistent across. So when we launched our new ambulatory EHR, it's really our new EHR, and it's usable in any of those kinds of settings. We just want it to be, I guess, a little humble and roll it out the right way. But it's the core is a cloud-enabled platform that allows users to interact and build on top of it. My sense is long-term, and this may be shorter term than I think, the EHR will become a commodity, and clinicians won't even know they're using it. If you look in other industries, when you're on Expedia and you're changing your seat, you're not directly changing your seat on United Airlines, right? It's Expedia on top of United, on top of American, and whatever. We are having clinicians work directly on those systems of record. That's crazy. They'll start to work on these systems on top that are more flexible, more users directed, and that EHR just becomes the thing at the bottom that records all the information, collects the information, moves it around. Now you can switch out your EHR. If you don't change my Expedia on top, I don't care what you do at the bottom. I like this app to make my travel, or I like this app when I'm seeing patients in the ER.
Right.
It doesn't matter. The EHR is the commodity system of record underneath, can go away. I don't think it's actually the value add. I think the value add's on top. Again, a differentiator between us and some of the other EHR companies.
Understood. Yep, it makes sense. Now, I mentioned earlier, I do case conferences. What case conference is for us, just to kind of give you a very brief summary, and this is my last question for you for today, but it sounds like we may need to bring you back again because we have so much to talk about. So in the case conference, we have two teams. I lead one of them, and my clinical director is leading one. And these are identical teams. I have one person from business development, one social worker, one pharmacist, and 4 nurses in each team. So they present cases because all day long, what they do is review cases, and we want them to present like 6 from each nurse. So I get 24 every week. So that's how I start my day. So one of the challenging one is psychiatry, psychology related orders that we have. So my primary care physician, or sometimes we propose those orders based on the patient's depression score or their medication utilization. Yet we send the patient for psychiatry, and then we are trying to get an update. They don't want to talk to us. So now you're a psychiatrist with that background, with the psychiatry background, with the technology being as advanced as where we are today. Can actually technology help us with the mental health integration issues with the actual patient care?
Yeah, so the technology is easy. What you're describing is some cultural things and stigma. So first, on the mental health side, before we even talk about integration, the technology is fantastic because, telehealth and cognitive behavioral therapy and evidence-based therapy and access are big issues that can be tech-enabled. Mental health, telehealth works really well. So that's great. And we do actually really well in that sub-market of behavioral health, electronic health records. It's a good spot for us. So that's one. But that's not your question. Your question was, help me get information from the psychiatrist back to my team and vice versa. And it's pretty fascinating. So I've had the opportunity to go around the world around how different cultures think about privacy. And in some places, that's wide open. And in some places, I would describe it as even worse, meaning it's not only there's that integration issue between mental health and the acute care. In some countries, you have to get permission from the patient anytime information goes from one doctor on the acute care side to another doctor on the acute care side. So it's even what I would call worse, if maybe it's better from a patient privacy standpoint. But as a clinician, I think, being able to see the whole picture of the patient is great. So what you're describing is more of a policy issue as opposed to a tech issue. Of course, we can transfer the information. We just have to be allowed to, and the person on the other side has to say, okay. I think the best way to get to where I think you're asking is really patient and family advocacy groups saying, I want this information to flow back and forth. Now make the policy and make my providers do it, because some stuff probably makes sense to stay private between your behavioral health person and the rest of your team, but most of it doesn't. Like, I need to know your lithium levels, whatever side of the fence I'm on. And so, or your medication changes because of drug-drug interactions. And if your depression's untreated, your diabetes is going to get worse. And schizophrenia doesn't protect you against heart disease. And if you've had a neurologic stroke, 50% of people have mental health issues within the next year. Like, this kind of separation, in my opinion, is sort of crazy. Maybe I don't have to share my deepest, darkest secret with my primary care doc if I've shared it with my therapist. But besides those kind of few examples, yes, this information should flow. And tech, that's not a tech issue. That's a societal issue.
Regulations probably is, again, we are one of the heavily regulated, but it's not practical. So, and each state has its own rules and policies and procedures, so it makes it even more difficult. But I think when we initiate the order, the consult, all we care is, like, is the patient getting the time, the care, and what plan? We don't really need to know all the history and this and that, what plan they have. So then are they showing up for their appointments? It's just because that's how we are going to be able to help, because mental health issue is one of the biggest maybe problems today in healthcare, and plus the shortages from the provider standpoint. So we want to make sure that they get the timely care that they need. So, but of course, these are never going to stop here. So first, I really want to thank you for this, because, getting an hour from you and you spending that time with us, it's extremely important for me. And I thank you for that again. And knowing Oracle Health and the way that driving the innovation in healthcare, and us from United Medical being part of this journey is extremely important. And also us being able to partner in certain new projects with your organization is extremely important for us. So there were a lot of good points that we covered. And, as I said, we always have, we don't stop learning, and we learn from each other. but we have a lot to learn from someone like you. And I hope that our people who are watching this, they also have the same benefit that I have. So thank you so much again.
You're so welcome. It's been a pleasure. Appreciate your partnership, the friendship, and also sharing the information about your sister and mom.
Thank you. Thank you. We'll see you soon.
Take care.
Bye-bye. All right, so we are wrapping up this session today. I believe that Dr. Erkan is joining me in the next 3 minutes. So we had a great session with Dr. David Feinberg, Oracle Health Chairman, and I believe there are so many good points we covered. And I know we have to elaborate some of these. The good news is we'll be able to continue these discussions. Seema Verma, former CMS administrator, who is one of the senior VP of Oracle, is going to join us on February 7th. I will probably hit her hard with those questions that I still have. So this is just not just for us, for United Medical, but any healthcare provider. This was an extremely good discussion. So hope you guys enjoy it, and we'll see you with Bariatric Friday in 2 minutes. Bye-bye.